Coming up on this edition of Being Well, Julie Vahling, Associate State Director from AARP, will be here to talk to us about the wise use of prescription medications. She'll be giving us some practical and easy to follow ideas on how to best manage medications, from keeping a medication record to the best ways to dispose of outdated prescriptions. That's all coming up next, so don't go away. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. AlphaCare, specializing in adult care services that range from those recovering from recent hospitalizations to someone attempting to remain independent while coping with a disability, chronic illness, or age-related infirmity. AlphaCare, compassionate professional home care. Additional funding by Jazzercise of Charleston. Thanks so much for joining us for Being Well. Our topic today is wise medications with Julie Vahling from AARP. Thanks for coming by today.
Well, thank you for having me, Lori.
So let's start off with, give us some thoughts on what are we doing wrong or right. Well, let's say, what are we doing wrong when it comes to prescription medications that might actually be counterproductive, that we're not even thinking about?
Okay. One of the biggest things that people are doing is that they're actually not following the directions that have been given to them.
Very simple.
Oftentimes, we hear from our physician what we're taking. We hear from our pharmacist when they give us the medication. But somewhere in between, by the time we get home, we don't really comprehend all of the directions. So that's probably the biggest thing, is that not taking medications in the proper dosage, not taking them at the proper time, not storing them correctly. Those are all three things that really a lot of people fail to do. A lot of it has to do with our daily habits. So we incorporate taking, let's say, vitamins in the morning, so we throw our medications in the morning, when sometimes the medication may be taken at night because of how it interacts in your body system.
So you got to read those directions, which when you get the prescription from the pharmacy, a lot of times it's a stack of paper with really tiny print that gets people a little bit overwhelmed. So what should we really be looking at?
Well, you definitely need to take time. We all know that our physicians are busy, and we all know the pharmacies are just as busy usually as the doctor's offices. But what we really need to try and do is make sure that when we're in those locations that we're thoroughly reviewing with those individuals in the medical field what the prescription is, like I said, how it interacts with other medications, and how you should put it into your lifestyle. One of the things that people often do is they get a medication, then they get home, and somehow it doesn't become a habit. And some medications aren't things that we're going to take for our lifetime.
Right.
Typically, though, people over the age of 65 have at least 3 chronic conditions and 5 medications that they're taking on a daily basis. So many people bring those medications into their households and use all the medications kind of the same way.
And they're not all meant to be taken the same way.
No, absolutely not. And oftentimes we don't think about the other things that we're doing in our life, whether it's the food we consume, the beverages we consume, where we store those medications. So there are a lot of additional things that we're going to have to explore a little bit further.
Okay, well, you've touched on some of these, but I want to give you, there's a list of 10 things that you gave me, and I want you to talk about them. So you go to your doctor and they say, Julie, you've got this new prescription. What are some of the things we should be doing to make sure that we are doing what we need to do so that medication is as effective as it can be?
Okay, number 1, know the name of the medication. And even though you may not pronounce it correctly, at least having a roundabout idea about what the medication's name is so important. For instance, I have a daughter who takes a medication for migraine medicine, or for migraines. I have difficulty remembering the name, but I've written it down and kept it in my wallet because I know that I get asked that question.
Yes.
One of the things that we really have to remember is that a lot of times, even though we don't necessarily have other specialists in our lives, when you go to the dentist office, when you go to the dermatologist, all of those people are going to ask you what medications you're on.
Yeah.
And we'll talk a little bit more about some useful tools that AARP has that people can utilize to keep those things in order. Another big thing, what are the side effects of that medication? Even though it may be written in very, very fine print on that nice folded stapled paper that you get with your medication at the pharmacy, a lot of us don't read that fine print. And we don't thoroughly understand the possible side effects. And as with most pharmaceutical medications, there's a landslide of items that can fall under side effect issues. When do I start? When do I stop taking this medication? I've actually heard of people who, the physician has ordered maybe a refill or, refills for a year, and individuals who thought, well, I'm out, I'm finished taking this medication. But it may be something that is either as a lifelong prescription or something that needs supplement refills. And so it's very easy for people to overlook those kind of things if they're not paying attention. What time do I take this medicine? My mother suffered from COPD several years ago, and one of the medications she took dealt with calcium. Well, she couldn't take that pill of an evening because you couldn't lay down for 20 minutes after taking the pill. That's a simple medication that a lot of people take, and they may or may not realize that taking it the right time of the day, there's a reason for it. And it's typically a medical reason. And so we want to make sure that people are taking the right dosages at the right times so that they get the full benefit of that medication. One other thing, will these medications work safely with other medications I'm taking?
Because a lot of people are on multiple things at
Multiple
once.
things, and that in particular with people who may be seeing more than one physician. Even in our world of electronic medical keeping today, there are still incidences where medications aren't recorded and aren't divulged to your pharmacist. And a lot of us, typically most people use one pharmacy. You have your family pharmacy that you've gone to for years. But what happens on the Saturday night when you go to the ER and end up with a medication for some illness? And then you go to Walgreens, even though maybe you don't typically go to Walgreens,
But that's
because
what's open.
it's the only place that's open. That pharmacist will not have access to the list of medications that you're currently on. And if you're not able to divulge to the pharmacist or to the doctor or the pharmacist what medications you're taking, you could have some serious, drug interactions, even as severe as death. So it's very important that people keep a consistent list of what they're taking. One thing that a lot of people also fail to do when they're in the doctor's office before they get on that prescription is, are there other steps that I can take to avoid getting on a prescription medication? Is it a change in my diet? Is it a change in my weight, my exercise habits? Are there other lifestyle changes I can make before I get onto that prescription medication? We have a wonderful world that we live in where we have access to medications to help with many illnesses, but they've also kind of become an easy crutch. As soon as you develop, high blood pressure, cholesterol, we'll get on a pill and lower it. And really, we all, for all of our best well-being, taking the steps to make lifestyle changes is always the best option. 100%. One thing too to consider, and to not be afraid to ask your physician, is this medication the proper medication for me with my gender or my age? There have been a lot of studies done to show that prescription medications have different results in your gender, whether you're a male or a female. And we've not had enough time to thoroughly explore the, thousands and thousands of prescription medications, but they have proven that there are different effects based on gender. So it is important to ask your physician, are there any studies on this? If I'm a female, is there something else that could be provided for that illness? One important thing, and kind of going back to the lifestyle change, is this medication something that I'm going to be on for the rest of my lifetime? And that's important because as we age, as our bodies change, there may be medications that worked well when you were in your 30s that maybe by the time you've, reached 50 or 60 years of age with hormonal changes or any other, body changes, it may not be the same medication, or it may be, an option to explore different venues. So I think that it's important that when people get on those medications, that they thoroughly understand what it means to the rest of their life.
And sometimes it's not, I think it's okay, and doctors have said, yeah, we want patients to be a little more proactive. It's okay, they're not going to be mad if you say, can we review this? Can we talk about this? Sometimes we may think, well, they're the doctor, I don't have a say in this, but we do.
We absolutely have a say, and that's probably the biggest message that I hope people take away from this program today, is that you are your own advocate for your health. Whether it's a procedure that a doctor recommends or whether it's a prescription that they recommend for you, you have to ask questions. I have all the faith in the world in my family physician, but I have to be able to be comfortable with him to ask the question of, is this right? Do I need a second opinion? Are there other avenues to go down? Because no one is going to speak for you but yourself. And that is so terribly important, to make sure that you're not just taking it at face value, that you understand why you're taking medications and what they mean to you. So one other thing, and I think that we'll talk a little bit more about this too, is, asking your physician. Herbal supplements are very, very big in the consumer world, and you can go into any drugstore and find a large aisle of supplemental medication that aren't necessarily regulated by the government, don't have proven studies maybe on their performance or their interaction with other medications. So it's always important to ask, and to let your doctor know what you take, regardless of whether it's prescription or over the counter, because many of those do have interactions with other prescription drugs.
Yeah, so don't leave that, they will. I mean, I was just at the doctor recently. They like to go through, are you taking this, this, and this? You got to remember the over-the-counter, because if you say, well, I'm taking X amount of this per day, well, that might actually be damaging to your stomach or your liver, some of the pain relievers that are over-the-counter, but you need to take into account all of those things you're taking.
Everything. And that's one of the things that we're going to talk about with our personal medication record.
Yes, that was my next question. Talk about the importance of that medication record. And I don't think it's just limited to people who are of a certain age. It's really any of us.
It is across the board. The personal medication record lists your name, your emergency contact information, your physician's information, and it lists every medication that you take, how often you take it, the dosage that you take it, the form that you take it in. It's very important that people annually review a list like this, and annually review it with your physician and your pharmacist, so that everyone is on the same page when it comes to your medical well-being. We also recommend that you keep this identification on your person, whether it be in your purse or your wallet. Keep one in the car. And why would you keep one in the car? If you're involved in a car wreck.
That's right.
And you are unable to respond to emergency responders or to anyone in the ER, there is a source of information that they have. You want to also keep one at your home. In the event something happens at your home, regardless of your age, that EMTs are able to access that, maybe with your vial of life, typically found in the refrigerator. So it's really important that we keep multiple copies. So one with our physician, one with our pharmacist, one on our person, one in our vehicle. Most importantly, one with our emergency contact information.
Yes, your caregivers. I had an incident recently where I went out to the ER with somebody, and I was just kind of there to support, and they're asking me all these medication questions because the patient really couldn't, at that point, you don't know if you're in an accident. You may not be able to answer their questions, and at that point, that medication record would have been really handy.
Yeah. And AARP offers these free of charge to anyone. So, I encourage everyone to call in and order and get a supply for your home, a supply for your parents, your brothers and sisters, and like you said earlier, regardless of age. And that's very important.
I want to go back to, you had talked about that they're actually, why it's important to talk to your doctor about all the over-the-counters, and if you're taking herbals or that there can actually be some interactions that they have said this could be a problem. Are there some that you wanted to talk about?
Yeah, and there are a couple. that I think are fairly commonly purchased at drugstores and at convenience stores. One of them, St. John's wort, which a lot of people take to help with depression. That can have some serious interaction with other depression medications. It can also interfere with MAO inhibitors and also with birth control pills. So it's one of those that people think, well, it's something natural, but those natural products can still have some very negative interactions with other medications. Another one that's kind of common, a lot of people take cranberry juice to prohibit urinary tract infections, and in all actuality, if you're on blood thinners, that's very, very detrimental.
Really?
It can cause excessive bruising and excessive bleeding. So, a lot of people incorporate cranberry juice into their diet for that very reason, and if they're taking those blood thinners, they can see some negative things. And that's one of those things, as far as like we referred to earlier about the things that you eat or drink. Usually our brains instantly go to the thought, well, alcohol, that's the thing as far as consumption with liquid that, most people say, well, no alcohol. Most prescriptions have that. But in all reality, there are some of those juices like cranberry juice and even some dairy products.
I've had prescriptions before where it says don't take with dairy because it makes it less effective or for some reason.
Yeah, it inhibits its action in your body. So, I mean, those kind of things people don't think about because you wouldn't think about cranberry juice or any juice, being something that could cause issues. One other one is melatonin, which a lot of people help as far as sleep. Yeah, and it increases the blood sugar. So if you're a diabetic,
that could be a problem.
That is a very, very serious issue. But melatonin is one of the most common, purchased herbal supplements that we have. So those are the kind of things why it's so important when you're at the physician's office to bring in that list. And I guess I'm kind of old-fashioned, but don't put it in your smartphone or leave it in your memory. Write it down and bring it with you when you go to the doctor's office.
So some of these things on their own, drinking cranberry juice is not a bad thing, or taking St. John's wort, but you have to look at what else you might be taking that could interact with
interact and have a negative effect.
So Julie, talk to us about when medications get old. What are some indications that they're getting old, and what is the best way to dispose of them? Because we've seen reports in the news where, there's some dangers in just flushing things down the toilet or, putting them down the garbage disposal.
Absolutely. Discoloration of any type of pill or liquid medication is definitely a bad sign. If the smell has changed on the medication, and also if you're taking in tablet form, if there's any change in consistency, if it crumbles easily, and or if you're taking any kind of liquid medication, if it changes in its consistency. Those are the most common signals that there's something wrong with the medication or it's expired. Biggest one, if there's an expiration date. And I think that it's really important, along with doing that annual list of your medications on your personal record, doing an annual clean out of your quote-unquote medicine cabinet. Many times you purchase a product for an initial use. You get a sinus infection or a sinus issue develops, so you buy some over-the-counter sinus medication, and then you don't really need it for maybe another couple of years. And then you get it out and you look at the box and you're like, oh, this is 2011. Well, it's 2014.
It's hard to throw that stuff away.
I know, and there's a lot of money that I guess that we put into those things, but it's for the benefit of us when we take it, so we have to look at that. One thing though too, as far as those kind of medications, even those medicines, throwing them in the trash or flushing them down the toilet, it really can cause some harmful effects if you have young children in the household who are able to access anything that you've thrown away. Of course, pollutants, if we put them down the drain, and even pets. So we have to be concerned about those things. So the best way to dispose of any type of medication is to take it to a local pharmacy that perhaps does a prescription medication upkeep or take in. I know that we have several in the community that I live in, but a lot of law enforcement have also gotten on board with that. And so those, if you do it once a year, if you clean out those cabinets, one trip, to the local law enforcement to drop off into a secure location is the right thing to do. I know that some people still utilize crushing medications and mixing them in a plastic bag with cat litter or something of that nature. That's still, as far as if you're looking for environmental issues, you really don't want to proceed with that.
Okay.
So
better to take them to a pharmacy, or I know I've seen advertisements for our law enforcement doing kind of a medication collection day. And it does, you know, as we know in our society, prescription drug abuse is going up. It inhibits some of the access to that too.
absolutely, and that is something that we try to prevent.
All right, so Julie, we've got 1 minute left. I want you to just give just some quick tips about what we should be doing as consumers to better manage our medications.
We need to make sure that we're keeping an accurate list. One of the things that we see in particular with a membership of AARP is we run into concerns about whether or not seniors are taking their medicines because of the cost, the financial.
Yeah.
Many times seniors are cutting their dosages and not taking it properly, which in turn can cause more harm than good. So we want to make sure that people are out there talking to their doctors and their pharmacists about alternatives, whether it's generic medication or other medications of the same form but from a different vendor. There are a lot of different programs out there, and sometimes it's just a matter of asking.
Right.
And if your physician doesn't know that financially, you know, you're concerned, they don't have any reason to necessarily
bring that up to you.
Absolutely. So it's your responsibility when you're in the physician's room to say, you know, here's my issue. Is there something that you would recommend? We want to make sure that people are taking the right dosages, the right amounts, or the right time, and so they're getting the full benefits of those medications.
Yes, and also keeping an accurate record of what you're taking.
Absolutely.
All right, Julie, thank you so much for coming by Being Well. We've been talking on the phone for a long time. It was great to finally get you here.
Yes, fabulous.
Thank you.
You're welcome.
Sugary drinks may do more than just rot your teeth, according to a new study. Too much soda can create a higher risk for diabetes, heart disease, and stroke. Now add to the list 4.5 years of extra aging. Scientists at the University of California, San Francisco have identified a link between daily soda consumption and shorter telomeres. Telomeres are parts of the cell that are essential to division and naturally shrink with age. But too much sugar in your diet can speed up the process. According to this study, 1 in 5 Americans drinks one 20-ounce can of soda every day. Research has proven mammograms can detect breast cancer early when it's still curable, but they aren't perfect tests. For instance, some women who have mammograms are called back for additional testing because the images aren't completely clear. Ongoing research is discovering a variety of other tools for detection, and one new technology called tomosynthesis is helping doctors see more clearly into breast tissue.
Hold your breath.
At first glance, it looks like this patient is getting a typical mammogram to screen for breast cancer. But this test includes new technology that allows doctors to see inside the breast more clearly than with standard mammography. It's called tomosynthesis.
Tomosynthesis is much like a mammogram, but what it's doing is it's taking additional pictures, almost like thin slices through the breast.
Mayo Clinic breast health specialist Dr. Sandhya Pruthi and radiologist Dr. Tara Henriksen say research shows tomosynthesis can detect at least 10% more breast cancers than standard mammography. That's especially important for women with dense breast tissue because both dense tissue and tumors show up white on mammograms. Cancers could be missed, or women may have to be called back for additional imaging.
This is an example where we have a traditional two-dimensional mammogram showing a little area of questionable distortion, which would be a callback. But this patient also got a tomosynthesis, which is the additional projection images that show that this area is just a crossing region of tissue, and there's nothing worrisome in this location at all.
Here, tomosynthesis, which gives three-dimensional information, eliminates the need for a callback for a false positive result. In this next case, the technology reveals a cancer that a mammogram missed.
This is another patient where we had a callback for a questionable new density in the outer breast. the patient returned and had tomosynthesis imaging as part of their workup because this was just a 2D screening mammogram. And here on our tomosynthesis image, we see that this is truly a mass lesion.
And I'm offering it more to my patients, and especially those who I feel have dense breast tissue or younger with risk factors.
Patients like Kate Manchester.
So my mom was diagnosed when she was 38.
Others in her family had breast cancer too, which puts Kate at high risk. She recently started yearly screening with tomosynthesis.
That adds to the comfort level of, knowing that I'm doing everything in my power to prevent, ending up with that same diagnosis or, early detection.
New screening technology that helps save lives. For Mayo Clinic News Network, I'm Vivian Williams.
Tomosynthesis is still new, so many healthcare providers cannot yet offer it to their patients. Mayo Clinic doctors agree that this technology may eventually replace standard mammography, but until it's widely available, all women over 40 should get yearly mammograms. Well, that's our show for this week. Thanks for joining us, and we'll see you again for another edition of Being Well. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. AlphaCare, specializing in adult care services that range from those recovering from recent hospitalizations to someone attempting to remain independent while coping with a disability, chronic illness, or age-related infirmity. AlphaCare, compassionate professional home care. Additional funding by Jazzercise of Charleston.